Shoulder replacement.
Local anatomy. Shoulder is the largest joint in the body. It is also the most complex joint. Parts of the shoulder: scapula, shoulder blade, humerus, upper arm bone, acromion, bony extension of scapula, clavicle, collarbone meets acromion in acromioclavicular joint, coracoid process, joint-like bony extension from scapula, rotator cuff, collection of muscles and tendons that surround shoulder, bursa, small sac of fluid, protects and cushions tendons and rotator cuff, labrum, cuff of cartilage from a cup ball-like head of humerus to fit in.
Total shoulder arthroplasty is the medical name for shoulder surgery. TSA aims to replace the damaged ends of the humerus and the scapula. Surgeons usually use plastics or metals to replace the bone, but other materials are used on certain occasions. TSA dates back to 1892 and was the inspiration for hip replacement surgery.
The shoulder is the most mobile joint in the human body. The most common shoulder injury in sports occurs in the rotator cuff, the group of muscles, tendons, and ligaments that controls the shoulder's mobility. The common term is known as a rotator cuff tear. Shoulder dislocations usually are anterior, but can sometimes be posterior. Anterior dislocation happens with the abduction and extension of your shoulder and your arm. Posterior is caused by internal rotation and direct blows and trauma. In baseball, pitching causes the most damage to your shoulder. The follow-through of the pitch irritates your rotator cuff. The most common shoulder injury in sports occurs in the rotator cuff, the group of muscles, tendons, and ligaments that controls the shoulder's mobility. The most common term, again, is the rotator cuff tear.
Rehabilitation. TSA usually takes about 6 months to fully recover. Over the patient's recovery time, they will wear a sling for up to 6 weeks. Patients will have regular checkups for 6 months. Patients are required to exercise their shoulder joint over recovery to help strengthen their new shoulder.